In this video, we're going to talk about how depth will affect what layer of tissue you're on, okay? And how the angle of your forearm changes the intention of your depth as well. So said two different ways. So in general, if we're at 5 to 10 degrees of a forearm angle from the surface that we're working on, when we go into our weight shift, we're more likely to be on the layer of skin and superficial fascia, okay? If we are more on about a 20-degree angle, we are at layer 1 of myofascial structures, okay? And I'm going to lower the table because we have that option. If we are at more like a 40-degree angle here, that would be considered layer 2. And if we are at a 60-degree angle here, that would be considered layer 3, okay? So 5 to 10 degrees would be skin and superficial fascia. 20 degrees would be layer 1. 40 degrees would be layer 2, and 60 degrees would be layer 3, okay? And the weight shift is basically exactly the same, okay? It's just you're changing the angle of the forearms and you have to sink into that layer of the tissue. You're not necessarily pressing harder, okay? So just general summary of how the angle of the forearm changes what layer you're on, which changes your intention of the soft tissue structure that you're mobilizing, and you want to find which of those layers has the hardest infill.